Hey, everybody, welcome to the RONLINE Report. Today's guest, if you're a reader of Muscular Development Magazine, you've been reading his work for many, many years. He is an IFBB professional, also a board-certified orthopedic surgeon, owner of Prisk Orthopedic and Wellness Facility in Pittsburgh, Pennsylvania. Please welcome Dr. Viktor Prisk. How are you, Doctor?
Great, Ron. Good to be back with you, doing some fun things with MD.
Yeah, this is actually our first interview, and I wish it was under better circumstances and not a pandemic, but, we work with what we got, right?
Yeah, it's a really rough time for all of us, but we're all coming together and trying to stay virus free.
What is the situation in Pennsylvania? Is your state on full lockdown or no?
Yeah, we're pretty much on lockdown for everything but essential services that are life sustaining, so to speak.
Yeah.
So that includes medical services of all kinds.
Okay, so you're good.
So I'm open.
Uh, yeah, so you are a medical doctor, so you would have a perspective on this whole situation that a lot of us Americans would not. And this is going out to the whole world. I don't want to alienate anybody here, but when you first heard about this, probably I guess it was about a month ago we started hearing about this. What were your concerns? Did you think it was coming to U.S. soil soon?
Whenever there's an outbreak of a virus like a coronavirus, I mean, the coronaviruses are, they cause the common cold. I mean, uh, almost everybody has a strain of the coronavirus at some point during the winter months. And so when they said it was a coronavirus, initially back in December, even I think December and January is when they first started talking about it in Wuhan. So yeah, I knew it would be something very communicable, and this particular strain does happen to be very communicable and quite virile.
It seems, I wish I knew more about this, but it seems like it spreads. It's mainly contagious through airborne methods, sneezing, coughing, people breathing too close to you. So if because every meathead's big concern now is I can't go to the gym, my gym's closed. If I use a pair of dumbbells that somebody with coronavirus just used, what are my chances of contracting coronavirus? If,
Pretty high if you touch your
hmm,
face.
oh boy.
So yeah, it is transmissible by aerosol. It aerosolizes and actually can hang in the air for up to 3 hours.
Oh my God.
So that's one of the worst parts about it, and that's what makes it very communicable. But also, it lives on surfaces for long periods of time, like plastic and metal can live a lot longer than cloth and things like that. But it can be there for hours and hours. So yeah, certainly, if somebody that has it goes to the gym when they shouldn't and touches a weight, and you pick up that weight and then touch your face, you're going to get it.
So as a orthopedic surgeon, you're seeing patients every day. What precautions are you taking to make sure you're not getting it from some of your patients?
Yeah, so we're screening people at the front desk, and at the front door even, and saying, hey, if you're having any symptoms, fever, cough, other flu-like symptoms, we're recommending that you do not come here. And we have hand sanitizer at the front desks. Everybody's supposed to wash their hands as soon as they come in. We even send them to the bathroom and say, and if we catch people that are coughing or sneezing, we'll definitely isolate them. And but we can't shut down. There's just too much to be seen, too many people in pain that we have to take care of. So we're keeping the doors open, but we're being very cautious. One thing that we can do is if we do know if you're going to the hospital to see a consult or something, and we think that somebody may have it or has symptoms of it, we're definitely wearing protective gear, whether it be gloves, masks, um, and even protective face wear. Um, it's even like shields. Um, it's something we have to be very careful with. And anybody who's in contact with someone who might be sick needs to be careful about that too. They need to have masks, and not just for the if the person who has it isn't wearing one, you should be wearing it, and vice versa. So you have to act like everybody's got it.
See, they were telling us, I think they're still telling us, unless you have symptoms, unless you're infected, you don't need to wear a mask. Do you recall hearing all those
That's
directives?
that's correct. So if you do not have any symptoms, you should not be wearing a mask.
Hmm.
You know you're going to be in contact with someone who has symptoms, or you might be in an environment where someone who doesn't know they have it, like if you're out in public and you're going to be in a situation where you are closer than 6 feet to somebody, or you might, for whatever reason, have to touch things that you don't know if other people have touched, you definitely want to have your protective gear ready.
Yeah, because we have all these people who are doing the essential things like medical personnel, people who work at supermarkets, places like Costco, BJ's, police, fire. They have no choice. They have to be in. They can't stay 6 feet away from human beings for another 2 or 3 weeks. So they're all, unfortunately, it would seem to me they're all at a very high, increased odds of contracting the
Yeah, I
virus.
mean, they have to take all the precautions. We're in the front lines here, man. When we're out and about, I'm in a room with a patient. I can't be 6 feet away from them examining them. So I'm
Yeah.
taking the precautions, and we have to trust one another. The biggest problem is these people like the spring breakers who are out there pretending
Mm.
like it's nothing. And I could tell you, when I was in college, my grandparents meant the world to me, and if I thought for a second that I had been exposed to it, I would never go see them or be out in public around people of that age. The risks are so much higher in those susceptible populations, especially above the age of 80. So,
And that's what really frightened me. I did a video on it a couple days ago because places like Clearwater, Florida, were not shutting down their beaches, and there were these. We saw these scenes of look like tens of thousands of kids just packing the beaches,
uh,
and all of them are going to go home because the college campuses everywhere are shut down. My son's he's home until September now from college from UMass. So these kids are all going to go home, and they're going to theoretically, they're not going to isolate and quarantine themselves from their families. They're going to give it to someone in their home,
right.
and someone is going to have a grandparent or an aunt or an uncle, or there are other. What are some of the other conditions where you don't even have to necessarily be elderly? It's heart disease, diabetes,
Well, so
lupus.
yeah, any condition that could be exacerbated by an illness like this, it's going to cause, it can cause like a very rare type of a pneumonia that causes a significant amount of inflammation in the lungs, and that's what puts people on respirators. So the first thing is that, yes, if you have heart disease and you get this, and it puts a lot of stress on you, and you're desatting and things, it can put you at risk for a heart attack. If you have asthma, it can certainly
Hmm.
flare that up. If you have COPD, chronic obstructive pulmonary diseases
Hmm.
of any kind, you could end up with a severe type of pneumonia and respiratory failure. So that's what puts people on respirators. Um, and then immunocompromised states, people who are on medications like Humira and Remicade, whether they have Crohn's disease or psoriatic arthritis, rheumatoid arthritis, those kinds of things, and they're on chronic steroids with a chronically suppressed immune system, they're going to
Hmm.
be at a lot higher risk for having complications. Complications go to not only the virus itself, but as a result of the respiratory failure and inflammation, you can end up with, bacterial pneumonia and those kinds of things. So,
Hmm.
um, yeah, that all leads to the renal failure and the heart disease and exacerbations and congestive heart failure from increased
Hmm.
pulmonary pressures and all this stuff. So, yeah, high risk for those people.
Yeah, this is frightening because my son is only 20 years old, but he was diagnosed a few weeks ago with ulcerative colitis, so he's on a medication for that. And one of the side effects is it is immunosuppressive. It's going to knock his immune system down a little bit. So I'm not letting him out of the house.
Yeah, it's probably pretty
It's
smart. And when he's out, he probably should wear a mask. It'd probably be a good thing for him. Yeah, I
okay.
think anybody who is in an immunocompromised state should be wearing a mask when they go out to protect themselves.
And you talked about respirators. If this thing spread much more than it is now, I don't know what the capacity is in the United States. I don't know how many respirators we have versus how many we might need. I have a
Uh,
feeling the need might outweigh what we have at some point.
but if you're talking about like a ventilator,
Yeah.
sometimes we talk about respirators, meaning like N95 respirators, which is something that will help protect you from the virus. We're running out of those too. But when
Mm.
it comes to having the ventilators that we can use in the ICUs and the same ones that we use in the operating room and stuff, we're shutting down elective OR schedules to even free up
Wow.
those ventilators that we use in the operating room for hospitals where it might be needed. We don't want to be having those used up. And then even we're cutting back on elective surgery schedules because of the risk of, people even being in the hospital near this and then having a complication of their surgery as a result of getting the virus during their surgery. And then it makes it harder to recover from that. So, yeah, we've got to be super careful with our resources. I owning a practice here, getting hand sanitizer,
Yeah.
nearly impossible.
Did
Because
you
we have
have
big,
some in stock, or did you have some
I
saved up?
do, and I've hid it because I'm afraid people are going to come in and say, "Hey, I'm going to steal your hand sanitizer and
Sure.
stuff." And I luckily have a little bit of a supply. I don't know how long it's going to last, to be honest, because I'm using a lot of it.
Hmm.
I've even asked the hospitals if they could give up some, and they're saying no.
Yeah.
It's really that's kind of selfish. I think I'd really like to have a little bit more support from the medical community around here as a private practice, but
Hmm.
we're managing, and we have ways to make by with isopropyl alcohol and do things with lotions and stuff. So
I mean, is isopropyl, rubbing alcohol, whatever you want to call it, is that just as good at disinfecting? Is
it
Lysol
is,
just as
but
good? Yeah.
when you're if you just use that, purely like the pads and things, and just pouring it on a 4x4 or gauze dressing and wiping it and stuff, you're talking about it gets pretty, irritating after a while. So
And
it's
you're going through a lot of it too, I would
and
imagine.
then we go through a lot of it, yeah. And I
Yeah.
use a lot of that for just treatments for injections and things. We're giving testosterone injections, or we're giving knee or hip or shoulder injections. We're using alcohol and betadine, and
Right.
so I got to use it for that too. And if I run out, that's another thing we were having trouble getting, is just the alcohol bottles.
Yeah,
So
I'm sure there's a million stories out there that everyone can chip in, but my daughter and her husband live in a fairly upscale apartment complex, and they had a hand sanitizer on the wall in the room with the trash chute, bolted to the wall. Somebody ripped the whole thing off, and
oh my god.
these are not poor people. It's really insane that it's coming to this. Um,
So
what
hand
rec?
washing is just as good. So if you're, you know, if you don't have access to hand sanitizer, do the 20-second wash thing. Sing your happy birthday. Sing your
Twice.
I will survive, or whatever
Oh,
it is. You
okay.
know,
Yeah,
those
I've heard.
those whatever song you want to sing. I mean,
Well,
what are you going to
you're a
sing, Ron?
surgeon.
What
You're a
what are you
surgeon,
singing?
so you know a lot. I've been singing Happy Birthday twice. So, I've seen surgeons like yourself preparing for surgery, and it's very involved. You guys are scrubbing. You have, I don't know what that orange
There you
stuff is.
go, finger,
Is that how? And you're going
finger,
up to the elbow and everything. Do we
finger,
need to scrub to that
finger.
extent like you would?
You kind of do. You want to really get between all of your fingers. You want to get each finger. Always get the thumb. The thumb is the one thing that people forget. And then wash front and back and get it all lathered up really good, and then wash off like a surgeon would.
Yeah.
You know.
Would you recommend that people, if they don't have to be in contact with other human beings, that we really isolate ourselves until this thing blows over?
Yeah, I mean that's what's being recommended.
Hmm.
Isolation, pretty much. I think that you have to have friends and family that you trust to hang out with. If you're going to hang out, have small groups at the house or something like that. But I think the more contact that somebody has outside of that circle, the circles get bigger and bigger and bigger.
Yeah.
The higher the risk is of transmitting it. And it just matters, if you're young and healthy and have no risks and you want to take that risk, it's okay. But as soon as you go, you never know. And you got like a son like yours who's
Yeah.
at home, that
I mean,
could be a big.
he wanted to go over a friend's house. We said no. He wanted some friends to come over. We said no because I don't know where these kids have been. I don't know if one of them has it, might give it to him or everyone in my house.
Right.
This is frightening.
So I,
If
I worry a
yeah,
lot about, some of the ramifications of this isolation, when it comes down to what's going to happen. Like my wife's a psychiatrist, she's IFBB pro as well, she's a psychiatrist, and man, she last time that we had a crash in the market like this, in 2008, we had a lot of suicides.
yeah.
Now we've got a crash in the market and we've got isolation. That's
We
it's a
also, I mean, there's so many people that are going to lose small businesses. There's a lot of people who they lost their entire income because they can't go to work. Food service
yeah.
workers. There's a lot of industries that are just devastated right now, and their employees are So yeah, that
Yeah,
is the psychological toll of this on
I
is
have
sort of tied into the
employees that can't
financial.
come. Yeah, I have two employees who have lung disease and can't
Wow.
come in. They can't work. So it's not that they're not going to lose their jobs. Their jobs aren't going anywhere, and we're doing some things to help them work from home and help us out.
Mm.
But when it comes down to it, this is a pretty severe crisis because of what it's doing from an economic impact, and then the impact of this is going to go on for years.
Mm.
Um, there's a lot of arguments that if you look at the number of deaths that are going to occur from this virus versus the number of deaths that's going to come from the economic impact alone,
Wow.
it's like a wash. So
Wow.
it's kind of scary. Yeah.
Huh. Yeah, because people were downplaying this for a while because they were comparing it. They say more people die from the regular flu. This is the media blowing it all out of proportion. And I saw. I'm sure you could enlighten me more on this, but I saw statistics on the Spanish flu of 1918, and the mortality rate was something like 2.5% of all people that contracted it died. The mortality rate for this, I believe, is between 3 and 4%,
Yeah.
and the world population is probably 10 times what it was in 1918. So we're looking theoretically, unless we're all very vigilant in every country quarantines, could be millions and millions of deaths. I mean, if 50 million people died from that, then we could be looking at, what, 100, 200 million people dead before this is all said and done?
I mean, that's what some of the estimates are saying. I think that, since we just don't have enough testing ability, we're going to find that there are a lot of people who've already had it or been exposed to it, or, you know, in 80% of the cases, it's going to be a mild to moderate flu-like symptom.
Hmm.
It's going to be, you got a runny nose, maybe some body aches and chills, and it goes away in a few days.
Hmm.
It's just going to be that small percentage that ends up getting the more severe respiratory symptoms. And you just compare it to the regular flu. Yeah, the regular flu, the influenza A, B, whatever, they can cause deaths, extreme rates, but we have a
Sure.
vaccine for that, right? So
Right.
we know that we get our flu shots at the beginning of the season, and we hope that we got the right strain with the flu shot. And I think, what is it, 40 or 50% of the time we don't have the right strain
Right. Yeah. Yeah.
or whatever, but at least it protects, more than half of that population that would have otherwise died. And so if you say that it's like has a 1 to 2% mortality rate, and this has 3 to 4, it's just a matter of when we find a vaccine to get it under control. Um,
Which
yeah,
is not, it's not going to happen any day soon. Vaccines
and
take,
getting a test that everybody can get whenever they come into the ER with symptoms, so we know how many people actually have the coronavirus and have no symptoms,
mm,
or that's the one thing we don't know what the denominator is at this point. We just don't know how
mm,
many people actually have already had it, or
you know,
didn't have any symptoms from it.
so on social media, of course, everyone's an expert and everyone's throwing out their theories, their ideas on how to solve this. And I've heard some extreme suggestions. And one was make it mandatory for every citizen to be tested. And if they test positive, they're to be confined with like an ankle bracelet or something to their home
Oh
so they
God,
can definitely
yeah,
not spread the disease, which, I can't see that happen in the United States. I just, it's a stretch.
yeah. There's going to be a lot of civil and human rights violations there, I would imagine, if you tried to lock people up with this. But in a crisis like this, they do have the ability to do it.
I
If they
mean,
want to come knock on your door and send you to a quarantine, that they possibly could, just based on the disaster declarations and everything. So
I mean, in the past century, when tuberculosis hit, I believe they took the infected had to go quarantine in homes with other infected people. They were basically just there to die, but at least they weren't spreading tuberculosis to the general population anymore. But we're not. This is 2020. We couldn't do that anymore. It's
yeah,
just. It's not.
we have better ways. We're smarter. We know that we can control the transmission by protective devices and things, and letting people stay in their homes. I think is it's a reasonable thing. Um, it's a scary time there, Ron.
Yeah.
Hopeful that we'll get some solutions. I've been getting some phone calls from people saying, "Well, give me a script for chloroquine. It's supposed to cure it and stuff." Well,
Yeah.
or hydroxychloroquine. These are medications that are used for parasitic infections like malaria, as well as for rheumatoid arthritis and other inflammatory conditions, even for ulcerative colitis, like azathioprine and things like that. So, I mean, these these are used for their anti-inflammatory effect mostly, and I think that's where they're getting relief of the severe inflammation symptoms related to the virus in the lungs. So, no, we should not be taking that medication without having symptoms. It's not without consequence. It has its own toxicity. So,
Because
uh,
I'm sure you're following this a lot more closely than I am, but we are getting these reports from other countries where supposedly they've treated coronavirus victims with a cocktail of different drugs
yeah,
successfully.
yeah.
Is this actually happening, or is this just wishful thinking and rumors, you think?
No, I think it's actually happening, but right now some of it's anecdotal because we're not doing really the clinical, evaluation statistics. Enough people doing the same protocol to understand what's working there. I think that that's still a little bit of an infancy. I think that the main thing there is, though, you're talking about people getting treated with it when they've had it.
Yeah.
It's not prophylactic, and it's going to be a long time before we know that if there's an outbreak and you take chloroquine for for a number of days, weeks, or whatever, consistently, that number one, you don't have any complications of that. So there's a risk benefit ratio is towards the benefit, and that we actually do have a statistically significant improvement in symptoms and or progression of disease. So I think that we'd be crazy to start having everybody take these medications at this point, because we'll probably end up with more side effects and complications of that. And then, of course, the medical and financial consequences of those complications. So,
Yeah.
whether it be developing other infections, because they are immunosuppressive in some respects as well. So, yeah, I think in all the research is so infantile right now that
Hmm.
we just have to give it time.
I'm sure we have the world's top minds in disease control and epidemiology. They're all trying to develop a vaccine right now. If a successful vaccine was developed, how long would it even take before that's mass produced and distributed to the public?
Yeah, they're saying it's going to be anywhere between 6 months to a year. So, yeah,
We don't got that kind of time.
no, no. So that's all we can do is we can continue doing what the CDC recommends, which is the social distancing, the proper hand washing techniques, the coughing into your elbow or into a tissue,
Yeah.
preventing the aerosolization of the virus, and just being respectful of others. Knowing when you're sick, stay home. You know,
Final
even
bit
if
of
even if you
advice.
don't have if you don't know if you have it or not, if you haven't been
Yeah.
tested, just stay home if you're sick.
That's what I want to get at, because the last thing I'd like you to address is there are some gyms that are still open. And I got friends texting me say this place is open. You have to make an appointment. It's a 45. They only allow 20 people, 25-minute time, 45-minute time limit. But these people they're psyched that they can still go lift weights at a gym. And I could do it, but I'm too afraid. I do not want to be the guy that brings that back to my family and my, God forbid, my son.
Yeah.
Wouldn't be able to live with myself. So can you please address all the bodybuilders out there who are insisting on going to get their deadlift on and their squat session on at the gym?
Please stay home.
See, they don't listen to me, but they might listen to you. Okay, cool.
Do push-ups,
Yeah,
air
I mean,
squats.
everyone's got a couple
Lift
of
your
dumbbells.
girlfriend with your arms. Build those biceps like doing it the caveman way. Whatever
Yeah,
you got to do, just stay home. It's
yeah,
not worth it to go to the gym at this point. Stay on a strict diet, veggies, protein. You know what we do in bodybuilding. That's what we do. We stay in shape. We live the lifestyle. Don't
yeah.
sit home and eat bonbons. Okay. So I mean, literally, you just have to stick to a routine. We're all going to get a chance to build a little bit more.
Yeah.
If you really want to be on the head of the curve, man, just do your workouts at home. I mean, most folks that like to work out in bodybuilder are going to have their equipment at home. Do something.
Yeah. Yeah.
But man, It's a good time to work on your sit-ups. It's a good time to work on a baby if you need to work on that.
I think there's going to be a lot of
There's going
babies
to be
born
a
in
lot
9
of
months.
babies. I
Whew.
think that we're going to have a huge
Yeah, this will be like the
baby
second baby.
booming.
It'll be another baby boomer generation comes out of
It
this.
could
I
be.
think
It very well could be.
coronavirus babies. Well, Dr. Prisk, thank you so much for taking
Yeah.
the
On that
time.
note, I'm gonna.
Yeah. Yeah, you need more kids, or you're all good with kids? Oh,
I got fur babies, man. Just the dogs.
okay, well, you're good. Yeah, I was fixed.
Very
I'm all done. But okay, cool. Doctor, is there a website where people can contact you if they want your services in the Pittsburgh area?
sure, and I'm even doing telemedicine now. The Medicare has allowed us to kind of bill for regular visits as telemedicine visits. So they really lifted a lot of restrictions being able to do that at this point.
Yeah.
So they can reach me at orthoandwellness.com.
Orthoandwellness.com.
Yeah, orthoandwellness.com.
Cool.
And we are open if you're in the Pittsburgh area and you need some medical treatments. And we do everything from orthopedics to all the body, and we also do all the wellness stuff. So
I always say, if you're a bodybuilder or a serious weight trainer and you need an orthopedic, this is the kind of doctor you want. A doctor that really understands the type of injuries we have and the kind of functionality and things we're looking for from a surgery. So, guys, this is the man to see if you're anywhere in that area or can get to that area. Dr. Viktor Prisk. And also every month, is it Nutrition Performance at MD? Is your column?
Nutrition performance. Yeah.
Nutrition Performance every month in Muscular.
Supplement performance. Yeah.
Okay, yeah, I get mixed up.
Yeah.
I got coronavirus on the mind. Well, doctor, thank you so much for taking the time. Appreciate it. Great to get your perspective, and please, you stay safe too. You and your loved ones, everyone, stay safe, guys. That's it.
Thank you, Ron. Yeah, everybody out there in the MD universe, be good, stay home, stay safe, and be well.
Cool. All right, everybody. Thanks for watching RONLINE Report with Dr. Viktor Prisk. See you next time.
Yeah.